everyone/afternoon. We are going to get started. I am here with Dr. Connie Jones, and she'll be talking about broaching multicultural considerations, addressing culture with substance use and disorders. And she is an assistant professor. She's president of International Association of Addictions and Offender Counselors. She's currently in the Department of Counseling and Education Development at the University of North Carolina in Greensboro. And I just want to thank you so much for being with us today, Dr. Jones. She does have a PowerPoint presentation. We're going to go through that, and then she will leave some time at the end for questions. If you do have questions, you're more than welcome to unmute yourself. If you're not comfortable, because we are recording, you're more than welcome to drop a message in the chat box, and I'll be monitoring that as well. So I will turn it over to you, Dr. Jones.
All right. Thank you so much for that wonderful wonderful introduction. I'm getting used to this presentation style. I can't see myself right now, so I'm really trying to figure that out. Okay, I can see myself there. So I am thrilled to be here today. I am excited to talk about this topic, and anytime I have an invitation to talk about this topic, it makes me excited. So thank you all for attending today. I'm very humbled by your presence, and as has been stated, I will go through my presentation, and I will leave time at the end for questions. And if you think of anything where I'm going through, as has already been said, you can just type the questions in the chat, and we will get to those at the end. All right, so let's jump right into it. All righty, so we're going to talk about broaching multicultural considerations, addressing culture within substance use disorders. And sorry, again, like I said, the technology, I'm trying to figure this out. Awesome. All right, so the agenda for today. I'll do a brief introduction of the topic. We'll discuss my background to give you a little bit of the relevance of how this topic came about for me. And then we'll talk about the research. So this presentation will be based on research that I conducted that I am still writing some manuscripts for, and I currently have some articles out about it already. So my hope is that you'll gain insight into the benefits of broaching, that you'll learn strategies to incorporate broaching behavior into your work. And then again, like I said, at the end, we'll have time for questions. So a little bit about my background and interests, how I came about researching this topic. So before I started my doc program, my clinical experience was basically working in clinical mental health agencies, public agencies, and working with the addictions and substance use disorder population. Then I also had a focus on multiculturalism, diversity, and social justice. And that, I am so sorry. And I also have interest in cultural humility, cultural sensitive treatment, and cultural competence. So I wanted a dissertation and research that kind of tied everything together. My clinical work, what I was focused on in my educational background, and I wanted to tie in my experiences from my clinical work and seeing clients drop out of substance use disorder treatment based on what I considered was due to cultural factors. So I'll give one example that really motivated me to go back into my doc program or to apply for doc programs. I was working with individuals who had been recently incarcerated and who also had been diagnosed with substance use disorders. We had one situation where it was an older Black male, I think in his mid-50s, and his mother had recently passed. And so he came to group because, of course, it was mandated. And so when he arrived at group, he was very agitated. He was very angry. At that point in time, we did not know that his mother had passed. And so I was co-leading the group with a peer who was also a counselor at the time. And she identified as a white woman, and she was in her about mid-20s. And so because this client came to group, and like I said, you could tell he was agitated and angry, and it was a bit frustrated. We eventually found out it was due to the fact that his mother had passed. Well, my colleague actually wrote a letter, which without my knowledge, to the probation officer, because this individual was on probation, and stated that this individual was not making progress in treatment due to the fact that he did not properly process his emotions, because she felt like he should be sad and depressed, but he was very angry and frustrated. So she wanted him to express his grief in a way that she perceived to be the correct way to process grief. And because of that, his probation was revoked and he was violated and was actually arrested that same afternoon and was incarcerated and ended up missing his mother's funeral. So from that day forward, and there were some other stories that happened as well, but from that day forward, I was frustrated and I vowed that I wanted to make a change in the field. I wanted to change the way that counselors were educated about culture and about how we look at clients and understanding others' worldviews. And particularly with any client, but particularly those in the substance use disorder population. And that's because oftentimes we only see someone who's addicted. We don't think of them as a person. It's like we just have to attack the addiction. But they also bring in a whole cultural makeup that influences their treatment, how they see drug use, how they see their, I guess, probability for, becoming clean. So again, when I came into my doc program, I wanted to combine my past experiences also with the knowledge that I was learning in my program. So it had to be something that encompasses substance use disorder, clinical mental health agencies, multiculturalism, diversity, social justice, cultural competence, and cultural humility. And I also wanted to make sure that my work was going to basically be about effective clinical practices for treating clients. So I always want my work to tie into something that individuals in the field can use. The counselors that are seeing these clients daily are the ones that I say are in the trenches. And so I wanted my work to be able to speak to those individuals to say, hey, this person knows what it's like to work with clients with these disorders. And this is maybe a tactic that I can use, or a skill that I can use to work with clients. So that's just a little bit of my background. So what I ended up learning was that in addiction treatment, oftentimes we were not incorporating culture and multiculturalism into treating clients. It was more based on the medical model and the disease model that was strictly of, this is an addiction, this is what needs to happen, right? So it wasn't looking at who the person was, what influenced their use, family history, as far as treatment, can they afford treatment? What treatment works for them, right? Was there any culturally sensitive treatments that were being incorporated? And when I found like it wasn't. So when I delved into the literature, I found out that was not present, but there was a lot of conceptual pieces that were asking for individuals to consider culture when working with this population. So I ended up coming up with a study that explored the experience of licensed professional counselors. And I wanted to discover if they broached, whether and how they broached multicultural considerations during the initial clinical interview with clients who were diagnosed with substance use disorders. And the reason I wanted to actually, and this was a qualitative study, and I'll get into some more of those details in a little bit, I wanted to hear firsthand from the individuals who work with these clients. Again, for me, those are the individuals that are working in the trenches. Those are the individuals who are experiencing clients every day, right? So I wanted to hear what they were thinking and what did they see when working with clients when it comes to culture, and if they were addressing culture with clients during their meetings, particularly the initial clinical interview, which can also be referred to as the intake or the diagnostic interview. So, all right. So again, a little bit of the background of the study. A reason that I feel like diversity and multiculturalism is important, like I said, with all clients, but particularly with the substance use disorder population, is because this population is so diverse. Addiction spans all cultural identities, right? It transcends every identity. There is not one cultural identity that can say, hey, addiction doesn't affect my group. It doesn't matter your religion, your race, your ethnicity, your socioeconomic status, your social class, your religious background, your sexual orientation, your gender identity. It transcends all of that. Nobody is exempt from addiction. And if you process and even reflect in this moment, if you just take a couple of seconds, you probably can think of your own personal life, and you are connected to addiction or someone who's addicted in some type of way, whether it's a friend of a friend, a family member. So addiction affects everybody. So then also, as counselors, we have a duty to provide culturally competent treatment, right? So our code of ethics states that counselors must provide culturally competent treatment. When we're providing assessments and intakes and things of that nature, we're supposed to be looking at the whole person. It's supposed to be holistic, right? So that was another reason the study became so important to me and why I felt like it was needed. And there was very little research concerning how to incorporate multicultural considerations into substance use disorder treatment and assessment. And again, this was based on the fact that the widely accepted model of addiction is the disease model. And the disease model asserts that addiction is genetic and a permanent disease that alters the body. There are critics of this model, and those critics introduce what we call multicausal models that conceptualize addiction as more of more than a disease. And you look at the individual as a whole. You look at their biology, you look at their environment, and you look at sociocultural factors. One model that you might have heard of is the biopsychosocial model. So we're looking at everything, not just the biological part of it, but the environment and the sociocultural factors. And what we found is that a lot of individuals begin using substances due to various reasons, of course, but some reasons are cultural and environmental. And so if we're not assessing for culture and we're not even thinking of clients as being influenced or cultural factors influencing their use or their patterns of use, we're doing a disservice, right? Like we're not properly assessing. The treatment options will not be based on the person wholly of who they are, right? And so if that happens, individuals may drop out of treatment or they're not getting the best, most effective treatment they can. So when we're not assessing for sociocultural factors, there's the possibility for misdiagnosis, a poor therapeutic relationship, and inappropriate interventions and poor treatment. Literature has showed us that as the dropout in substance use disorder treatment is a huge concern. That's been happening for years. And so because of that, we're trying to figure out what's causing that, right? Like what is contributing to the huge dropout in substance use disorder treatment. And one of those reasons could be that there's few models that incorporate cultural variables into working with the substance use disorder treatment. And this is where broaching comes in. So broaching may be a useful strategy or behavior for counselors to utilize when conducting their initial clinical interview with clients. Broaching can aid in providing culturally competent services. Now, as far as my research, I stated, and it's still my belief, and there's also other literature and research studies that have been done as well that kind of backs this up, that broaching and having discussions about culture and cultural identities from the beginning of the counseling relationship is vital, because the beginning of the relationship is when clients decide, particularly racial and ethnic minoritized clients, decide whether or not they will return for a second session. And this is where we start building our therapeutic relationship and our work in alliance with clients. It's from the very beginning, from the time that you even speak to a client in the waiting room is when that relationship begins. And the initial clinical interview is the beginning for most individuals of the counseling relationship. And again, some people may call it the intake and different things like that. And this is where broaching should take place. So, okay, so before I go any further, there's also an article that was written, that I wrote, about broaching behaviors of licensed professional counselors, a qualitative inquiry, and it is within the Journal of Addiction and Offender Counseling. This is based on the study, and I will get into some more things that are listed within that manuscript today, in that article today. Also, that article, the research that I'm discussing today it was the 2018 recipient of the CSI International Research Award. And just today, I found out that it was the top downloaded article for the Journal of Addiction and Offender Counseling from 2017 to 2018. So if you wanted to have the link or the citation, to have more information after this webinar is done, you can definitely go check out that article. All right. So most of these concepts and definitions you are already going to be familiar with. So again, the study was based around initial clinical interviews, culturally competent treatment, broaching substance use disorders, licensed professional counselors, and clinical mental health centers. And I still can't figure out which way to take this. All right. Okay. So again, the initial clinical interview is a common assessment technique that begins every counseling relationship. Sometimes it's thought of as the cornerstone of assessment. It usually occurs during the first 2 sessions of the counseling relationship, which focuses on establishing rapport, the preliminary diagnosis, and treatment planning. Okay, cultural competent treatment, again, I think we all know this, and of course there's not one singular definition for culturally competent treatment. So this is a definition that I came up with based on some of the literature. It's the treatment in which the counselor has the ability to effectively engage in practice with clients from diverse cultural backgrounds and has the awareness, knowledge, and skills to create conditions that maximize optimal well-being and functioning for the client's multiple contexts. So not just one identity of the client, but there are multiple contexts and the intersectionality of those contexts as well. So, a substance use disorder is the collection of the cognitive, behavioral, and psychological symptoms that signifies that a person continues to use substances despite experiencing problems related to their substance use. An individual invests a significant amount of time in obtaining, using, and recovering from substances. So it's important to point out with that substance use is a major public health problem that impacts society on multiple levels. Again, every community is affected by substance use, and no population or cultural group is immune to its effects. Now, I will point out that clients who come from non-dominant or identify with non-dominant cultural identities are more likely to struggle with addiction. Just some examples are clients who may live in poverty, unemployment, environmental factors, acculturation stresses, low educational attainment, self-esteem, and economic marginalization. All right, now broaching. Broaching is a term that was created by counselor educators to capture and describe the counselor's effort to explore the cultural factors and complexities of the client during the counseling process. It is a strategy or behavior that can be utilized by counselors to introduce or bring the discussion of cultural factors into the counseling process. It's vital that counselors consider how cultural factors may impact the client's presenting problem. Oftentimes, due to oppression and marginalization experienced by non-dominant groups, clients that identify as a member of a non-dominant group, they may be hesitant to introduce how cultural factors may be affecting their presenting issue, right? So due to the society that we live in, it is often taboo to discuss identities, right? Particularly like race, sexual orientation, gender, like people, those are not common conversations we have in everyday life. I would like them to be, but they're not, right? And so our clients are often used to what society has basically taught them. And everybody has been susceptible to cultural conditioning, right? So when they come into that counseling space with the counselor, it's the counselor's responsibility to create a safe space that is different from society and what's happening outside of those rooms. So we are the individuals that should open that door to say, hey, we can talk about culture in here. We can talk about your identities. We can talk about your life, right? Like this is the space to do that. Because if not, we can miss a huge fact of how cultural factors are impacting the client's presenting problem, how it's been impacting their patterns of use, and even their drug of choice, which I'll talk a little bit more about. So we have to make a conscious effort to broach and have these discussions. So the broaching strategy allows for counselors to create that safe space, free from shame and fear, in which the counselor can provide an opportunity to aid the client in examining how those social cultural factors may be affecting their presenting problem. So in my mind, as I was coming up with this research and thinking about substance use disorder treatment, I felt like broaching was an effective place to begin to improve treatment outcomes for members of the substance use disorder population, such as decreasing the premature termination rate from treatment. And it's important to point out that, again, in the literature and the research about substance use disorder treatment, it has been pointed out how cultural factors impact someone's treatment and the dropout rate. For instance, African Americans are 5 times more likely to drop out of substance use disorder treatment than white Americans. And being a woman is one of the most significant predictors of dropout. And that has been connected to things such as women having small children and families and things of that nature. And also 50% of clients from racial and ethnic minoritized backgrounds prematurely terminate from counseling compared to 30% of white American clients. So that in and of itself lets us know that we have to do a better job assessing for cultural factors and understanding someone's cultural makeup and their worldview, because they are bringing that into the room, right? So every interaction we have on a daily basis, but particularly in counseling, is intercultural. So we can't just assume that when a client comes in like, oh, this is just normal. It's like, no, they're bringing their cultural identities into the room and the intersectionality of those identities. And the counselor is also bringing their cultural identities into this space and the intersectionalities of their identities. So that is already in the room. And so oftentimes I know when I do this presentation or I'm doing trainings, people will say, well, hey, I don't want to bring it up because, you know, I don't want it to be off-putting to individuals. Well, it's already the elephant in the room because, again, we all bring in identities and we all have, and our identities impact the way that we see the world. So if we're not allowing that space for our client to explain to us how their identity and how their life and their experiences and their cultural makeup has impacted the way they see their presenting problem or their substance use, we're doing a huge disservice to the client. And for instance, when I say that, if we think about what often comes up is family history, right? So if you have a client who's like, well, every day my father, when I was younger, would come home and would drink a 6-pack of beer every day after work. That was my father's way of decompressing. And let's say this individual also is coming in to see you because they've struggled with alcohol for a while now. If that was their view growing up, is that their father used alcohol to decompress, and if you're not taking that into consideration as you're working with the client, you're doing a huge disservice because that impacted the way that person saw the use of alcohol, right? It was a way to just de-stress. The person didn't intend to get addicted, right? So as we talk about addiction, no client intends to get addicted to a substance. It happens, but they don't intend that when they first pick the substance up. So understanding what led to them picking the substance up, how did they see it when they first started, what was their history with substances, is important to know as you go through and process and work with a client and assess and come up with treatment options and interventions. All right, so when multicultural factors are broached during the counseling process, a couple of things happen. Broaching increases counselor credibility. Broaching enhances client satisfaction. Broaching deepens client disclosure and reduces premature termination rates and increases a client's willingness to return for sessions. So these are all the positive outcomes when broaching is utilized in sessions, in counseling sessions. Because of this, it is an important behavior to incorporate into your work because it increases your credibility with the client and their satisfaction. And like I said, with addiction, because clients is a huge dropout rate, it reduces premature termination rates. So it's worth giving a try in your work to see if it will contribute to effective counseling outcomes for the client. There has been research that has been based upon having racial and ethnic discussions with clients in the beginning. Having these discussions has led to a more positive working alliance between racially and ethnically different counseling dyads. It was found that clients of color rated white counselors as significantly more credible if they discuss racial and ethnic differences. Those same clients also rated the working alliance as significantly stronger if racial and ethnic differences were discussed. Another study conducted by Knox and colleagues was a qualitative research study. It explored the experiences of 12 licensed psychologists addressing race and psychotherapy, and based around whether or not they should raise the topic of race in their dyad. So what they found was that discussing race had a positive effect on therapy. Mostly all the participants reported that they addressed race directly, openly, and felt that the discussions led to a positive effect, such as enhanced trust in the therapeutic relationship. Also, discussing, another study found that if you discuss racial differences in the beginning, particularly the first 2 sessions of the counseling relationship, that it deepens the client's trust and comfort level. So, because of all of these positive outcomes that have been found in the literature and that have been found that broaching can produce, it is vital that we're doing this when we're working with clients, particularly in the substance use disorder population, and particularly if we're broaching early on in the first 2 sessions. And so you might say, why the first 2 sessions? Where again, this is where we're building the working alliance and the therapeutic relationship. We're trying to deepen that relationship. And it's been proven that the earlier and the sooner you talk about your cultural differences or similarities even, because it's not just about differences, it's also discussing just culture in general, that it strengthens the relationship. And oftentimes, if you have a client that may be from a minoritized background, they may not show up for a second and third session if they don't feel that connection from the beginning. So if we can jump in and have those discussions early and broach these identities, it may lead to reduced termination rates, right? And also with members of the substance use disorder population, the sooner you can discuss cultural identities and intersectionality of those identities and the impact on the presenting problem, the better. Because also when you're working with individuals with a substance use disorder, you are fighting against relapse and withdrawal symptoms. So you want to kind of have those discussions while you have the chance to have those. So as we're talking about broaching and talking about cultural identities, a lot of times I hear people will tell me like, oh, well, it's difficult to remember all the cultural identities that are out there. I don't often think about ones that are not important to me or that I don't value. Well, there are a couple of different models that you can use that can help you with that. So 2 models that I really, really enjoy and that I share with my students is the Dimensions of Personal Identity model, which breaks down identities in different dimensions. There's also my favorite model, which is the respectful model. I actually teach my students to use this model in conjunction with broaching. So you can pass this out to clients and have them review it. And you can just say, which identities stand out to you? What's important for you? What do you value? Or what influences the way that you see the world or your situation? And so with the respectful model, it's the acronym, and then each of the letters represent a different cultural domain, such as religious and spiritual orientation, ethnic and cultural racial backgrounds, and economic class standing and things such as that. So this is a model that you can use to help you remember the identities and cultural domains. So when you're thinking about broaching, there's 5 broaching styles. And each of these broaching styles, they range from less to complex broaching. So the first style is avoidant. These counselors that operate from the avoidant style come across as functioning in a race-neutral perspective. They basically feel that everyone is human, so there's really no need to discuss culture. There's no need to really delve into how do your cultural identities affect you. They believe that racial oppression shouldn't exist. But by doing this, they ignore the realities of society and the world that we live in, and they ignore the unique factors that their clients are bringing into the space. The second broaching style is isolating. This is the counselor that does broach, but they do it in kind of like a nonchalant way. It's kind of like a one and done. So it's like, hey, okay, I brought this up. I mentioned it to you. Now we can move forward. So it may be as a one-time occurrence or a singular question or one statement. The broaching seems very disconnected. The next one is the continuing and incongruous style. So this counselor does invite the client to discuss the relationship they see between their presenting behavior and culture. These counselors they operate from a very anxious perspective around broaching. They want to broach, but they don't have the appropriate skills to broach. And so they they may have some parts that are effective, but not really sure of themselves, and is not always effective. The fourth style is the place. The fourth and the fifth style is where we really want people to be or to work towards. The fourth style is incongruent and integrated and congruent. These are the counselors that effectively broach culture and have integrated broaching behavior into their professional identity. They view broaching more than just a technique, and it's became consistent and ongoing part of their practice. And the final style, the infused style, this is basically the broaching style when it's not only a behavior, it has become a way of life for the counselor. So not only do they do this in their professional world, in their professional work, they also do it in their personal life. They are highly committed to social justice and equality. This counselor works from a dependent level. Like they don't feel like they have to do it for their work. It's like, this is what I want to do. This is part of who I am, and this is part of how I see the world. So if you sit here and reflect on where you think you would be right now and where you will want to be, that's something I always ask people to think about. So what style do you feel like you fall into, and where would you like to be? So in the Davines and colleagues article from 2007, they stated that they believe that broaching behavior is dependent on the counselor's level of racial identity. So one thing about broaching that I always tell people, you have to be sure of where you fall in the racial identity development model, and how comfortable are you having discussions about culture and cultural identities, because that's going to show up in the room with clients, right? Like if it doesn't seem authentic and genuine, the client will get that feeling from you. So it's important to assess yourself and where you fall on the racial identity development model. And two models that we use a lot of the Helms white racial identity development model and the Helms people of color identity development model. And broaching behaviors seem to parallel the counselor's level of racial identity functioning. So it's really important to become honest with yourself and really assess where you are and how comfortable you are discussing different identities. So I've had people tell me, like, I can discuss race and gender, but I'm not going to discuss sexual orientation. And I always tell them why. Discovering why you will not have those discussions. Figuring out your blind spots and figuring out your biases and your stereotypes is going to be very important, because you're going to have a client sitting across from you, and that client may trigger you because you haven't been honest with yourself about your blind spots and stereotypes. So, a counselor's racial identity development may impact the way they broach, and it also may impact the way that a client actually receives your broaching and having these discussions. So this is a table that, again, is from the Davines and colleagues article from 2007. And basically it combines the broaching and racial identity development into one table. So you can look at the racial identity status, and then you can also see how that aligns to the broaching continuum or your attitude towards broaching. So just for example, if we say the racial identity status of contact, these individuals are oblivious to their own racial identity. Their uncritical acceptance of racism or colorblind perspective about race. Now, how does that carry over to broaching? They may avoid broaching. They may refuse to broach, and they may see broaching as being unnecessary. And like they take a race neutral perspective to working with clients. So again, all of that is background. It tells you, like, so it ties into the study of, like, okay, now I want to know whether and how counselors that work with the substance use disorder population, are they broaching during that initial clinical interview? I had several research questions. The first being, how do LPCs who conduct initial clinical interviews perceive the relevance of identifying multicultural factors to their work with clients with substance use disorders? The second question, how do LPCs who conduct initial clinical interviews describe the term and concept of broaching? And lastly, whether and how do LPCs who conduct initial clinical interviews introduce or broach multicultural considerations during the initial clinical interview? So this was a qualitative research design. I used purposeful sampling, and the data collection was semi-structured interviews, demographic questionnaires, and field notes. I'm gonna skip through some of this just for time. And so there were 9 participants. As you can see some of the demographics of those individuals. So the findings, let's jump into this. So I will focus more on research question 3 and going into more detail. But for the first research question, I think it's important to point out that all of the individuals who I interviewed felt that everyone has culture and it's encompassing in general, and that multicultural factors impact substance use behavior and patterns. So I thought this was very interesting because every LPC said that multicultural factors impact the way that a client perceives their substance use patterns and influences their behaviors. So I was very excited when I heard this because I was like, okay, that means we're talking about culture, because if you all are seeing that and believe that and recognize that culture is impacting the behavior and patterns, therefore we have to be working from a multicultural perspective because we know this to be true, at least in their practice. And they also identified that cultural identities emerged during their very first session or the initial clinical interview. So they saw culture from the initial session. And they felt like multiculturalism was an important component in counselor preparation. Now, research question 2 was about the concepts. Were the counselors familiar with the concept of broaching and the term of broaching? So the first finding was they were not familiar with the broaching term, which I thought was interesting. The second finding was that broaching was defined as initiating a topic. So basically, I found that they used the Webster or the American English Dictionary definition for broaching, even when I asked them to put it in the context of counselor education. And lastly, there was some degree of understanding of the broaching concept. So even though they didn't understand the term, they understood the concept of broaching. Now, research question 3, which is where I'm going to focus for a little bit before we turn to questions, was about whether and how do LPCs who conduct initial clinical interviews introduce or broach multicultural considerations during the initial clinical interview. There were 5 themes that arose from for this question. The first was that I found that the broaching approach varies. So some individuals said they were fine broaching directly. So they would, for instance, I had one participant who stated that she openly discussed race, gender, or anything else. She was just direct and blunt with it from the beginning because she felt like it was an elephant in the room, so you might as well just get it out there. I also had individuals that stated that they felt like the indirect approach was better. So they would use the intake or the initial clinical interview and the information that the client would list to pose questions and go deeper. So for example, if the person said they listed they were married, they would delve into like, oh, how long have you been married? How has that impacted you? But they would not come out and directly have that discussion themselves if the paperwork did not ask that question. Now, with that, it has been found, so one of the ways to broach in the most effective ways is to be direct and upfront. And again, as soon as you can in the sessions. So first and second sessions would be great to broach and to do it directly. Okay, secondly, what I found which was interesting, is that 8 of the 9 participants stated that they felt more comfortable if the client introduced multicultural factors. This was the issue because, as I stated earlier, because a lot of individuals who come from minoritized backgrounds may not feel comfortable and may not be sure if they can introduce those topics because society and the world has taught us differently. So, and there's also a power dynamic in the room. So there's a perceived power dynamic, let me say that. Regardless of how much we try to have a collaborative relationship with our client, there's still this perceived power that you're the counselor, they're the client, right? So you have to take that into consideration if you're expecting the client to broach. And that's really not the way, because it's up to the counselor to set and start creating that safe environment that is free from guilt and shame and openness. So next was appropriate timing. Many of the LPCs thought that there had to be appropriate timing to talk about culture. And some of them felt like it wasn't the first or second session, and it may be the 5th and 6th session. Now, with that, I have to ask, is that for the counselor or is that for the client, right? Like what makes, who is more uncomfortable having that discussion? And remember, this is only about opening the door. This isn't about forcing the client to have the conversation. It's just about the counselor opening the door to say, hey, I am open for these discussions. We can have these throughout our counseling relationship together. And if you set that tone from the beginning, you already know that the seeds have been planted. And in case the client needs to say something, they can go back and say it, right? And you got to remember, when we're working with the addictions and the substance use disorder population, those clients bring in a lot of shame and guilt already. Just it comes along with addiction, right? There's a lot of things that have happened while they were in their active addiction. There's a lot of relationships that have ended, or they burned bridges with. So the shame and guilt is there. So we're working with a population who was already bringing that in. So it's very important, let me say that, for the counselor to set that tone from the beginning, not to wait to the 6th and 7th session, because you may not have that time, because the client is already coming in with a lot of feelings of, and maybe not even feeling safe, right? You don't know how many times this has been for them to try to get clean or to get into a program. So appropriate timing, you can never really say when it's appropriate time. You can't say it's going to be the 6th session, because what if it's not? What if the client wanted to bring up a cultural issue session 3, but you all have never set the tone, or you haven't began your relationship saying and talking about cultural things are okay, or the impact of those social cultural factors. The next theme was willingness to be open. So every participant that was in the study agreed and stated that you had to be willing to have the discussion, you had to be open to having the discussion, and you had to be open to hear what the client had to say to you. No matter, you couldn't be afraid if they say, like, yeah, I've had a bad experience with a client with people who look like you or people who identify as you. You have to be open to have that discussion, and you have to be open to sharing a little bit about yourself. Not to the fact that it takes over the session, but the client may also ask you, what has been your experience, or how do you identify? And you have to be comfortable with your identities as well. And the last thing was boundaries surrounding broaching. So what I found interesting was that many of the LPCs stated that, again, that they would discuss certain cultural identities, but not others. And they would only discuss the identities that they felt comfortable discussing, and identities that they felt as being vital or important or salient to them, right? And I was like, that's a little tough, because how can you tell a client what identity is salient to them? And how can you say, I'll discuss this identity, but not this one? Again, that comes back to a counselor issue, where we have to assess our stereotypes and biases and our comfort level with things, and why we may feel that discomfort. So those were the findings that came up from research question 3. So when broaching, it is important that you be genuine and authentic. Clients can feel the energy and can sense when you are not comfortable. So if you're not comfortable having these discussions, why should I be comfortable opening up to you? Why should I be comfortable discussing these things if you're not, right? So you have to come from a genuine and authentic place and figure out which broaching style is for you and that client in that situation. You have to practice broaching enough that you can figure out how you want to approach it and what style works for you, again, because if not, it's going to come across as that isolating style, like kind of like a one and done checklist. And honestly, what they found is that if you're going to approach it from like a one and done, like, hey, I made the statement, I got it over with, you're actually causing more damage to the counseling relationship and to the client. So just don't do it if you're not going to be genuine and authentic and truly open to hearing what the client has to say. And if you truly are not concerned about their cultural well-being and their cultural identities and their worldview, just try not to broach then because you're going to cause more harm than good. Secondly, you have to be open to the conversation. So don't present it and just assume that you're not going to have a conversation with the client, because the client may actually want to have a conversation and you don't know where they're going to go with it, right? Your job is only to open the door. But after you open that door, you have to be prepared for whatever comes after. So again, be prepared for any response. The client could say, hey, I don't want to talk about this. That's fine. You open the door. That is their right. It is the client's right to decide where to go with the conversation. It is your duty to initiate the conversation or to open the door. Lastly, It may feel like you are out of your comfort zone, and that is okay. So I want to normalize that for you. You may feel some discomfort, and that is part of the process, and that's okay. But don't let the discomfort stop you from utilizing a behavior or a technique or a strategy that will be beneficial for the client and be beneficial for you all's counseling relationship. So, implications for counselors working with the substance use disorder population. Counselors should be intentional in identifying and engaging in discussion with clients concerning multicultural considerations during the initial clinical interview. So, the counselor should go in with the intention to broach, right? Like, it should not be, oh, I forgot to do it. It should be part of your normal process when working with clients, and particularly with the substance use disorder population, because again, they're coming in with shame and guilt already, and a lot of thoughts about treatment. So trying to create the safest environment and create an environment where they feel like they can bring their whole selves is very important. Secondly, so I didn't mention this in the findings for research question 3, but many individuals stated that it was very difficult to have discussions about culture with clients during the initial clinical interview because of administrative things and paperwork, right? So they were like, we have to get paperwork out within a certain amount of time for insurance purposes. And so I don't have time to talk about culture. I only have time to get through the paperwork. So, which is the issue, right? Because that can go back to the reason we're having premature termination rates. So if a client is coming in and they feel like it's only about the paper and they're only another body coming into the session, they may not return, right? And then we're fighting against the relapse and withdrawal, so they may go back out. I mean, we can't stop until, I mean, we don't have that much power to, make somebody stop using or to make them go use. But if they're coming in and feeling like just another body, and that you don't see who they are holistically, we are not providing the most multicultural treatment that we can from the beginning of that counseling relationship. So it's important that we start to advocate for different administrative structures or implement personal changes to our intake process in order to allocate more time to assess for and discuss multicultural considerations. Because again, every interaction we have is intercultural, so the culture is going to show up in that space regardless. So if you're discussing it or not, it's there. So lastly, for the counselors working with the substance use disorder population, it's important that counselors continue to attend trainings and workshops and concerning diversity and multiculturalism. So it's important that we never get to a point that we're like, hey, we know everything there is to know about cultural competence or cultural humility and about diversity, because we don't. This is a journey and this is a process and it doesn't stop. So it's important that counselors continue to attend trainings. It's important that counselors continue to practice broaching and implementing broaching into their work and recognizing what works for them and what doesn't work for them. So continue educating yourself and attending trainings and practicing broaching, and try practicing just in your daily life. I mean, even with friends, with family. Even I always tell my students, when someone's sitting across from you, even if they look like you, it doesn't mean you all have the same cultural makeup. Y'all are different individuals who have different experiences and have different intersectionalities of identities. So you have to take that time to get to know each other. Even like I always use an example, even if you grow up in a house with a sibling, it can be like, you can be totally two different people. You have similar experiences, but culturally you're still different in some way. So figuring out what that culture means to that person and what does the impact of that culture mean on their presenting problem or their issue is important. So implications for counselor educators. It is important to educate our students on how diverse the substance use disorder population is and be purposeful in discussing models that illustrate the complexity of human beings. So again, make sure that we're sharing with our students that addiction transcends every cultural identity, and making sure that we're utilizing models that also discusses culture and sociocultural factors and not just the biological factors. So again, one of my favorite models that I work from and I train my students when working with this population is the biopsychosocial model. And if you also, like I said, another thing is to use the respectful model or the person, the dimensions of personality. I mean, the model that I showed earlier of personal identity. There you go, sorry. And so those are models to also use to work with our students. Secondly, preparation programs should be purposeful in discussing models, as I just mentioned, the respectful model and the DPIM, which is the model I just mentioned, so that we can help our students or these future counselors learn about these different cultural domains and learn about different cultural identities. Because if they are part of a group, or if they're not part of a particular group, they may not even think about the group. They may not think about that as a cultural domain. But for their clients coming in, that domain may actually be important to them. So teaching them about that. For instance, one that I know people always think about is like location and language. Like where individuals are from, the language they speak, things of that nature, and how that has impacted individuals, of how they see the world and things of that nature. But if you're not thinking of that, you can overlook that when you're doing assessments and treatment planning. And lastly, educate students about broaching, ensuring that the term is being used and there's a level of consistency in understanding and training. So one of my lifelong career goals is to teach people about broaching, and so they can understand it, and to train more individuals about broaching, just in general. It's a term, it's something that most counselors are already doing. And so for them to see it as a behavior or a skill that they utilize, or to teach individuals that it is a skill or a behavior that they can utilize, is very powerful. So after I conducted these interviews, I did follow-up interviews. And every individual told me that after they had the interview with me, that if they were clinical supervisors, things of that nature, they went and took this information back to their supervisees, back to their units, or back to their treatment teams, because they hadn't thought about it. And so if we can make this consistent in training and in the way that we think about working with clients, we may be able to have better, more effective, positive outcomes for working with clients. So again, there's some limitations from the study. Future studies, of course, is just more quantitative and qualitative studies focused around broaching in the substance use disorder population, also around cultural identities in the substance use disorder population, and with the treatment that we're providing. Are we providing culturally sensitive treatment to individuals who identify with a substance use disorder? All right, so I know I was trying to fly in towards the end, but I wanted to make sure we had time for questions. So I will pause here and open the floor.
Thank you so much, Dr. Jones. That was awesome. So I wanted to also echo what Dr. Sean Smith wrote in the group chat when talking about your publication being the most downloaded. Just excellent work on that for sure. And then we have one participant, Erin, who said, I'm having issues with my internet connection, so you're cutting out a lot. I'm going to leave the meeting, but I wanted to let you know how wonderful and informative this talk and training was. I've lived overseas my entire life, so 98% of the clients are of a different ethnicity, culture, religion, and so forth. Thank you again, Dr. Jones.
Thank you. Thank you.
Of course. So any other comments or questions? We'll give people a few minutes. People are welcome to unmute yourself. Just know that it is recorded. Or you can put something in the chat box if you have any questions for Dr. Jones.
Dr. Jones.
Yes.
Thank you very much. I truly appreciated the information you shared. So thank you very much in doing so and sharing your space here this afternoon. I did have a question.
Yes.
In regards to broaching. Early on, you indicated in your presentation that broaching begins in the first contact in like the waiting room. I'm wondering, based on your experience, your research, and what you've shared today, would it be a stretch to suggest that broaching?
Out of my office.
Would it be a stretch to suggest that broaching would begin earlier than that? And what I'm thinking of is perhaps at the initial phone call or screening, or before we actually see someone? Am I making sense?
Yes, I think that's a great question. And for me, I think we set the environment for broaching from the beginning, because I'm not sure if we can have the conversation, because so many different agencies, they may have administrative assistants answering the phone, things of that nature. So I don't know if they feel comfortable having that discussion. But I will say that there's a lot of things that we can do to like create an environment where the client may know that broaching is coming. And for example, this is what I mean. Like even our paperwork and our forms. Like how many times have you all seen forms where it just says like gender, like male, female, or woman, man, right? And so what message are we already sending to the client? Right? Or if certain group paperwork I've seen, because my students bring it up to me all the time now, and they'll bring me stuff like, this is so wrong. They'll list like 4 racial ethnic groups and then just put other, right? So it's like, so if I'm not one of these 4, I'm just an other. So being very, very conscious of what we're listing and how we're listing things on forms. Like you also see married, right? Like married, single, this is, so there's a lot of different types of relationships. So it's either we either need to do our research and have more options, or we just need to leave a blank and let the person write it in, right? And let everybody write it in how they decide to identify. And because it's really important, that's one of the big parts about broaching as well, is letting the client identify who they are. So if the client comes in and tell you that they're purple today. You do not argue with that. You do not say anything about it. And I know that has come up a lot of times with my students. They're like, well, the person said they're this, but they're not. So an example I gave this a similar talk a couple of weeks ago. I had someone say, my client came in and said that they're Black. And I corrected them and told them that the correct term is African American. And it was not I, the person who identified as African American or Black. And they were telling the person how they should identify. And the client was upset and made a complaint, and the person couldn't understand why. Mm-hmm. So I guess I'm saying, like, you know, if we can set up an environment where we're being conscious and thinking about the different identities and how we are presenting ourselves as agencies or counselors, if you have a private practice, that's important because that will set the tone of broaching.
Okay, thank you. So to begin, a more inclusive mindset from us as clinicians, counselors, supervisors, educators, and then expanding that to a more inclusive behavior in our approach, in our practice, in our paperwork, in how we do things, in our interaction, would be first, probably a 1 and 2 step. Does that make sense?
Yes, yes, that is perfect.
All right. Thank you very much. And again, thank you for your work, your leadership in the field. I'm excited and very, very humbled to be here today, part of this dialogue. Thank you.
I appreciate it. Thank you for the invitation.
So along with the lines of when you're talking about forms and what clients should have on those things, Janelle commented that disability questions would be helpful perhaps before the client comes in to make sure the agency is inclusive of others. So remembering that identity is a huge part of it, but then also are we addressing disabilities as well?
Yes.
And then we have a question for you. So do you have any advice for minority counselors when it comes to broaching with clients from different minority backgrounds or bringing up culture even with clients from majority populations when relevant?
Yes. So I want to say, yes, Dr. Bettis, you're exactly right, because ability is also one of the cultural factors and domains that we look at. And so people often forget that, but that's also important. And so if we're asking those questions also for agencies prior to the client coming in, that would be great. So with broaching with clients from different minority backgrounds, so my advice would be, you look at everybody. You already know that you can't predict what the response is going to be. So just personally, so being a woman of color, identifying as a Black woman, I've broached many times. I do it with students and with clients currently in the practice that I work at. And I will say it's always most of the time it's a shock when I bring it up. I'm like, hey, I noticed that, you know, sometimes I point out the similarities first. So again, with broaching, it's important to also say that we have similarities and differences. So one way that I start all my broaching statements, no matter who it is, hey, in this counseling relationship together, you bring in a whole cultural makeup, worldview, and life experiences that I may not have. And I also bring that into the space as well. But this space is about you, and I want you to feel comfortable and safe in this space. And I want you to always know that we can talk about cultural identities, cultural makeup, what has impacted you in your world with no judgment. And so even as I'm saying, it depends on the client, because again, you have to figure out the client and who you're working with. Sometimes I'm very direct and I'll say, hey, let's say if I'm looking at a form like, hey, I see you identify as Asian American, I identify as Black, right? So there's probably some differences and similarities in the way that we see the world. Is that something that you would like to discuss right now? Do you feel like that's important? And, you know, I leave the ball in their court, right? And sometimes they will say, wow, I've never had anybody say that, or, ooh, you really shocked me. Like, I wasn't expecting that. Like, I don't know the response. Now, it can be different also majority populations. There's actually a study out there that looked at counselors of color broaching with individuals, white individuals, right? And a lot of times you'll see a lot of microaggressions and things come up, but you also have to remember for some individuals from the majority population, they probably haven't had those discussions either. And they probably haven't had a person of color bring that discussion to them. So it may be an initial shock factor. And for some people, it's going to be a sigh of relief because they see that, right? So they may see that you identify as a person of color. And so that's in their mind anyway. So when you bring it up, they may say, oh, I'm glad you said it because I was thinking it when I walked in here. And so I would say broaching across the board is just going to look the same. You have to look at everybody as a blank slate, right? So you don't know anything about this person. Regardless of this, what you may have gathered by looking at them, you still don't know. Those are all assumptions. So you just have to say, this is a client sitting across from me, and I need to open this door to see what they present me with and to see their worldview. So.
Awesome. Thank you. Similar to that, Meyer said, hi, Dr. Jones. Thank you for the information on broaching. I had not heard that term before, and it makes perfect sense that we as professionals be trained to include it in our practice and how it will create a stronger therapeutic alliance.
So let me, so I will say to that, always get pushback. So here at UNCG, we teach the Counseling Diverse Populations class the very first semester, right? So I have a classroom about 37 students. And when I talk about broaching, they always give me pushback in the beginning. Like, no, I'm not going to do that. I'm not comfortable. I'm not going to have these discussions. It never fails. By the end of the second semester, when they're in advanced practicum seeing clients or either during their internship, they come to me and say, oh my goodness, that changed my whole relationship with this client. I took the time to broach, and now I feel like we have a stronger relationship. I feel like now, like, they're opening up to me in ways that they hadn't. And so they see the benefit later. And so it truly does work. We as the counselors just have to get to the place that we're comfortable doing it. And we have to be comfortable with like who we are and what and how we identify. And also we have to be honest and open about how we have biases and blind spots and work through those. So.
Yeah. So we're actually out of time. So I don't know if you wanted to say any final thoughts or any last things people should take with them.
Yes. So, let me see. So final thoughts is, I was trying to put my contact information up there, but you all can, I think it's out there already. But what I want to say is, even if you have discomfort about broaching, I want you to know that it's normal, okay? Like, don't feel like there's something wrong with you or that you can't do it. And you don't have to be a multicultural expert or diversity expert in order to broach, right? This is really a technique to help us strengthen our relationships. And so try it out, practice it. It is okay. And it might not work every time. You may fall flat on your face in the beginning, and that's okay, right? We learn from doing and from practicing, right? So just continue trying and continue being dedicated to multiculturalism and your growth along this cultural competence and cultural humility thing, because we never reach an end point. We have to continue growing. And so, yeah.
Awesome. So awesome. So I want to thank you for taking time out of your day and being with us. And thank everyone for joining. This is actually one of our last webinars as a part of this very long, amazing year of about 13 webinars altogether. So we very much appreciate the time you took, Dr. Jones, to give us this information. Again, this is a part of the AMCD Professional Development Series. We should have this video and all the other videos up around July so people can rewatch them. And yeah, I hope people enjoy their summer. And thank you, Doctor. This was just amazing, and I really appreciate it. And also, fantastic job on the publication. Absolutely.
Thank you
Okay.
all so much. Thank you all for joining today, and I'm deeply humbled, so thank you.
Awesome. So if people do have questions, please reach out to Dr. Jones directly. Or if you have questions for me, my name is Daisy Daniel, and you can reach out to me as well. So you guys have a great day, and we will see you in the next one.
Thank you all.
Bye.